So he was my mentor, and I told him that, sir, I want to take up surgery, but everyone's dissuading me from doing it, and they say that you're a woman and you should get married and have children, but I want to be a surgeon. So what he told me was, Manjula, do what you want, follow your heart's desire, but just ensure that if it's a family that you want, that you allow life to go hand in hand with your career. Don't put life on hold to for your career to go ahead. Just ensure that everything happens at the right time, um, which I think is very, very good advice for all the women out there.
Hello all. In continuation with various programs and episodes on breast cancer awareness, we bring powerful stories of various breast cancer patients and survivors and insightful discussions with doctors and experts. Today, we are privileged and honored to have Dr. Manjula Rao. She is a consultant breast cancer specialist and oncoplastic surgeon at Apollo Proton Cancer Center at Chennai. She has a rich background and experience from prime institutions and hospitals like Hinduja, Tata Memorial, and so on. Hello, ma'am. We welcome you on the platform of Sugarshell.
Hi, Sushmita. Thank you so much for having me here on this platform, and thank you for wanting to interview me and know your opinion. So it's a pleasure.
So, ma'am, talking about the various official statistics, we found that there is a steep rise in breast cancer cases in India. So, as you have been working very closely in this field, what is your take on this, and what is the scenario in India, especially?
There definitely there definitely has been an increase in the incidence of breast cancer over the last many years. In fact, early this year in Feb 2021, the WHO in fact announced that breast cancer has replaced lung cancer as the leading cause of cancer in both men and women all over the world. It is also the leading cause of mortality. So we must, and the situation in India is no different. The numbers are rising. The reasons attributed to this are many. Apart from lack of awareness and lack of a population-based screening initiatives in the country, the reasons attributed for rising incidence is, of course, the increasing urbanization, the westernization of diets, urbanization of lifestyles. You asked me how different is the Indian scenario from the rest of the world. So usually breast cancer earlier was known as the disease of the older age groups, women over 55 and above. In India, however, the incidence for this occurs in women at least a decade younger. So we see a lot of younger women, 40, 45 years of age getting affected with breast cancer. And of course, as we very well know, breast cancer occurring in the young is more aggressive in nature, which is why this is something that we need to address, and we need to increase awareness amongst people about the various symptoms and the presentation of breast cancer, breast lumps. I think this is the need of the hour.
Ma'am, as you mentioned, it is also happening in men. What is the statistics on that?
Breast cancer can occur in men, yes, but of course very rarely. So it's only 1% of the male population that is known to be affected by breast cancer. However, what is worrisome is that men, obviously, they have very less amounts of breast tissue. So when a cancer does occur in them, if it is not picked up immediately, it very quickly can become advanced or locally advanced, in the sense it affects the posterior muscles and the anterior skin very quickly. So, which is why it is quite, it is essential that men are also aware that they can be affected by breast cancer.
So, talking about the medical advancement have been really good enough in India right now. So, what and how patient can benefit with current medical advancement?
In India, we have every medical advancement that is known, at least for cancer care, and especially breast cancer care. We have everything that is offered abroad, which can be offered here in India as well, be it in the diagnostic process, or at for treatment evaluation. And we also follow the international guidelines, especially at Apollo Proton Cancer Center. We are very careful and sensitive about following evidence-based management. And we have routine multidisciplinary treatment discussions. We have MDT discussions every morning, where each and every case is discussed amongst the group of experts. So it includes me, of course, the breast surgeon. We have our medical oncologist, radiation oncologist, our pathologist, radiologists. All of us sit together and we discuss the best possible treatment as per evidence-based guidelines for that particular patient, and we ensure that they get the best treatment that is probably available today. So yes.
So talking about prevention, what comments or suggestions you like to give so that we can do it in our day-to-day lifestyle habits and food habits especially to avoid this dreaded disease?
So the main factor that is supposed to be responsible for breast cancer is supposed to be increasing exposure to the female hormone estrogen, right? And as you know, estrogen is a female reproductive hormone, and that is what makes all of us women, and it is present in every woman. Which is why one of the main risk factors for breast cancer is said to be being a woman and increasing age. So being a woman and growing old every year is one of the main risk factors for breast cancer. It's quite ironic and also tragic. But giving you this information is not so that we spread fear amongst the women and in society. I'm telling you this for the sake of awareness, because I strongly believe that knowledge is power. And with this knowledge in hand, that being a woman itself puts us at a risk for contracting breast cancer as we age, it will help us be more aware. So only 10% of the breast cancer incidence is attributed to genetic causes, inheriting a known genetic mutation such as BRCA1, BRCA2, etc. The remaining 90% of the incidence is attributed to very sporadic causes. So they say it's probably because of increased exposure to estrogen hormones. So it could be, certain modifiable, non-modifiable risk factors, such as women who, attain menarche. Their periods begin at a very early age, and they attain menopause at much later age. So, the whole cumulative period of exposure to estrogen is quite wide. Similarly, women who, have children after the age of 30 or who don't breastfeed. So, during these periods, they are continued to being exposed to the female hormone estrogen. Having knowledge of all these factors itself, gives the woman, empowers the woman with what is required to be aware that she may be at a risk for breast cancer. So it is very important for a woman to have knowledge of her family history, to know if there is any family history of cancer, what are the diseases, if there is a history of cancer, what types of cancer, how many members in the family, and this is up to a level of the second and third degree relatives. And if they've, say, had breast cancer, then at what age did they contract the cancer? Was it in their 30s, their 40s, their 50s? So this is very, very important. Secondly, women and men, I think everybody should be aware that the predominant symptom of breast cancer is having a breast lump that is painless. Very often what happens is that if they have a lump, but it's, not painful, they'll say, oh, that's okay, it's just something that's sitting there. Probably it's a fibroadenoma, they don't do anything. But that is one of the main symptoms of breast cancer, a painless breast lump. So I think it is important to convey to the audience that any symptom that is out of the ordinary, any symptom at all, any change or deviation from the normal ought to be shown to their doctor, be it a breast specialist or an oncologist or a gynecologist. It has to be investigated by means of radiology, be it an ultrasound or a mammogram, and a core needle biopsy of the lump. And finally, I think another step towards increasing awareness is spreading the knowledge of self-breast examination among society. I think that is the easiest, simplest, and quickest way, for us to be aware and mindful. It takes only 5 minutes of a woman's time, every month, and it can be done either in the shower or when she's lying down. So I think this is the least that we can do for ourselves, for our health.
So, ma'am, in order to talking about mammogram, I recently, while talking to one of the women in my group, one question popped out regarding what is the best age to go for mammogram testing, as it is very much related to radiology and radiation. So please comment and suggest on that.
So, as per, the international guidelines, there are various international medical bodies that have put out guidelines. So in India per se, we don't have a national population-based screening program. But in the United States, they do advise women of the age of 40 and above to undergo routine annual mammograms. By annual, I mean once a year. Similarly, in the United Kingdom, women are advised to undergo annual mammograms once they hit the age of 50 and above. So in India, the doctors of Apollo, we've come to a consensus saying that, women over the age of 40, they ought to do a mammogram. They can either do it once a year or they can do it once in 2 years, up to the age of 45. From the age of 45 and above, it would be better for them to get an annual mammogram. So a mammogram once a year, right? A bilateral mammogram. So a mammogram of both the breasts once a year, starting from the age of 45 onwards. Irrespective, it is always, since we don't have a screening program as such in India, it is very important that they meet their breast specialist, their breast surgeon, an oncologist once a year for a routine breast health checkup, and then do the investigations that they're advised. So this is very important.
So, ma'am, talking about the various treatments and phases a patient go through, basically what treatments generally happens, and what you will suggest or comment on?
So when a patient presents to us with complaints of a breast lump, I'll tell you the first step, of course, is diagnosis. So diagnosis is basic. It's something that we call triple assessment. Examination by a breast specialist, followed by imaging. So the imaging could be an mammogram with an ultrasound, or an MRI with an ultrasound, or a mammogram ultrasound breast, as well as an MRI. It depends on a lot of factors what imaging we would require. And once the imaging is done, then of course we require a biopsy. So when I say biopsy, I mean a core needle biopsy, because we use a 12 or a 14 gauge needle, and that to do the biopsy, and that gives us adequate material for us to do something called a receptor testing. So what is very important in breast cancer is the biology, right? The nature of the disease. And this is told to us by 3 markers: the estrogen receptor marker, the progesterone receptor marker, and the HER2/neu receptor. So we try to get these details from the core biopsy specimen. And once this diagnosis is established and what type of cancer it is, we stage the disease. So for staging the disease, a clinical examination is important, followed by a whole body scan based on the clinical presentation of the patient. So we can do a whole body PET scan, or patients may be asked to do a CT scan of the chest and the abdomen, and a bone scan. So this will help us stage the disease. So once we have staged the disease and diagnosed it, then we go ahead with the treatment. Now, treatments for breast cancer it may include all or a few of these treatments, namely chemotherapy, surgery, radiation, and hormonal therapy. So surgery is a must for breast cancer, unless of course it's widespread stage 4, wherein it has spread to all parts of the body, and then surgery doesn't really come into the picture, unless of course the intent is palliative, just to control it. Otherwise, we need to decide whether to give chemotherapy first or later after surgery, what we call adjuvant. So it'll either be chemotherapy followed by surgery, radiation, and then hormonal therapy if the patient is hormone receptor positive, or it would be surgery first followed by adjuvant, chemotherapy, and radiation, plus or minus hormonal therapy. And of course, chemotherapy also depends on what type of cancer it is. Is it HER2 positive, HER2 negative, so targeted therapy. Today we have immunotherapy. There are a lot of things that are coming into the picture, and each of these require a detailed discussion with the doctor. So today we don't really treat breast cancer. We are treating the individual with breast cancer. So when a patient comes to us with breast cancer, it is my job to find out what kind of breast cancer are they suffering from, so that we treat the individual, we treat that particular type of cancer. It's very, very personalized today, the treatment. So if you have 5 different people presenting on one day diagnosed with breast cancer, the treatment for each one of them may be different.
So during all this treatment phase and chemotherapy phase and post-surgery phase also, patients sometimes get confused which is the right clothing, or especially undergarment, which is very close to the skin, the first wear we generally wear. So what you will suggest one should look for, and not getting confused, how one should choose the right undergarment to use during this time and post-surgery?
That's actually a very relevant question, Sushmita. Thank you for asking me that. So immediately post-surgery, if the patient has undergone a breast conservation surgery, right, I would advise them to wear a support bra, right, a sports bra, a supportive sports bra, something to give them adequate support and also adequate compression in post-surgery. So now, what is so special about a sports bra? It has to be the right fit. It offers compression. It is very important that, since our aim is to offer support, it is important that the shoulder straps of the bra be nice and wide, so as not to chafe this area, or it needs to be able to lift the breasts up and support the woman's breasts up, rather than anything else. And same holds true for the wings of the bra. It would be better for it to be wider and broader, so as to offer a good amount of support. And the inferior aspect of the cups, post-surgery, it would be comfortable if it were not wired, and if there was a good amount of padding below, so just below the cup, if there is a good padding, so that it literally envelopes the breast. And in cases where we may have taken an incision, the surgical incision at the inframammary crease, that is at the fold, the junction of the breast with the chest wall below, then wearing a bra would just, that bit of that tiny band below may actually hamper our surgical results by causing pressure of the wound and causing trauma. So it's essential that we have a good thick band with a bit of padding to sort of give the breast that support and not cause trauma to the operated area. I think these are important considerations immediate post-surgery. Now, if a woman has undergone a mastectomy, she can wear a bra with a pocket, and once the wound has healed, she can wear a silicone prosthesis or an external breast prosthesis of any kind, whether it's made of foam, whether it's made of wool or cloth. But the only thing that I would suggest is not to have it come into direct contact with the mastectomy scar. It would be helpful to have it within the bra pocket. So there are specialized mastectomy bras, so they can place it within the bra pocket and wear the bra. If they do want to wear a prosthesis, such as the self-adhesive external breast prosthesis, it would be ideal for them to wait for 10 to 15 days until the wound has healed completely before they can actually start wearing that prosthesis. So that is immediate post-surgery. Now, during chemotherapy, be it prior to surgery, of course, there would not be any change. They can continue to wear the same bras that they used to wear earlier, or however they feel comfortable. Post-surgery, again, it's essential that they wear a support bra or a mastectomy bra. What is essential is that the wound be kept clean, and it would have healed by the time they receive chemotherapy. So they just need to ensure that their breasts are well supported, and the wounds are kept clean so that they don't break down. Because chemotherapy is a period of lowered immunity. There is a chance that the wounds can get infected and wounds can reopen. So these are the things that need to be that the patient needs to be cognizant about. Any sign of redness and fever and pain, sudden pain that's again restarted around the time during chemo, around the area of surgery, they need to go back and see their surgeon and report their complaints. Now, coming to the most important bit, radiation. At the time of radiation to the breast, we would recommend that the woman not wear any sort of inner garment or a bra of any sort, because it's very important that that area receive good amount of ventilation. So they're usually advised to wear loose cotton, breezy sort of garments that does not scrape over the area that is radiated. It can cause skin sloughing and a lot of morbidity. So that is best avoided. And of course, once the radiation is complete, 15 to 20 days after that, once they get the go-ahead from their radiation oncologist and their surgeon, they can continue to wear the same bras as earlier.
On this, I have two questions coming from patients while talking to them. One, doctor suggested her that wear sports bra, as you mentioned. But while wearing sports bra, she find it very tight and too much compression, and she felt very uncomfortable. So that is like one of the issues she faced while using sports bra specifically. And also, second question is regarding the material, because sports bra generally has a polyester material. What you will suggest in terms of material one should look for during this time of recovery?
Yes, I have a few patients who have complained about sports bra being very tight, but these have been women who've never worn sports bra earlier. Because they've never needed to. So this was a very new concept for them. So over here, I would like to highlight the point about sizing of the bra, which breast cancer patient or not, a lot of us are in fact unaware of. It is very important that a woman wears a bra of the correct size for her. So for this purpose, it is required that she measures the circumference of her chest at the level of the nipples, and then the circumference of the chest just below the breast at the level of the inframammary crease. So that will give you the under bust measurement, and the difference between the measurements at the level of the nipple and the inframammary crease, it will give you the cup size. Right? And cup sizes are not standard. It honestly varies from brand to brand, both in India as well as in the international market. So it's very important that the woman go to that store, she gets her measurements taken, and she undergoes a trial. She wears one size below, one size above, and figures out what is the correct size for her. And of course, if it's the correct size for her, it will be comfortable. So that is one. Now, second, what sort of material, that's very relevant. I would always say cotton. So in India, I struggle to find what we call a post-surgical bra that is found in the international markets, and women are provided that soon after breast surgery. So what's special about these bras is that they are compression bras. One, the materials are moisture wicking, they're antimicrobial, they are hypoallergenic. So all these are what is required to keep the wound area clean and microbe free. Also some of these bras are they have antibiotics incorporated into them, so a woman can continue to wear it for 7 days at a stretch without washing them, which is a matter of relief for the woman. Because here what's happening is, now when I ask them to buy a supportive bra, so I most often ask them to buy a sports bra, and I'm not sure whether, with all the sweat that's coming and accumulating, I'm not sure whether it's right for me to ask them to wear wear it 7 to 10 days in a row at a stretch. Also, another thing is, then I'll have to advise them to buy 2 or 3 bras to keep with them, and these are expensive. A good sports bra can cost anywhere from 2,000 rupees and above. So not everyone can afford this, which is a genuine matter of concern, because anything related to cancer care, cancer recovery, cancer rehabilitation, it should be universal. It should be accessible to all, and not just a particular, the privileged class. So this is something that is, quite frankly, the need of the hour. Another very, very important point about the surgical bras is the way that the surgical bra is worn. So many of the sports bras that are available now in the market, which I ask patients to wear as a post-surgical bra, it has to be, the woman will have to lift her hands or wear it, over the head. And that is, quite frankly, very discomforting, because the woman who has undergone breast cancer surgery, she would have undergone, surgery in her underarms or the axillary area. And at the time, abduction or lifting of the arm and the shoulder is restricted and very painful. So quite frankly, it defeats our purpose. There are very few brands that make front fastening support bras, and then again, they're very, very expensive. So that is another concern.
You rightly mentioned important but basic points which one should look for. Ma'am, moving ahead, we like to understand various myth-busting points so that people get more awareness and more knowledge around the breast cancer, and also about choosing the right innerwear during this phase and after that.
A lot of women come to me concerned, saying that they've been told that wearing a black bra, or wearing a bra at night when they're sleeping, or wearing an underwired bra can increase their risk for cancer. So let me tell you, women, that there is no evidence today in literature which confirms the same. So please feel free to wear any kind of bra, the kind that you feel comfortable in the color of your choosing, at any time of day or night. It is not known to increase your risk for cancer. That only 10% of the incidence of breast cancer is attributed to genetic causes. It could be because of known inherited genetic mutations. That does not mean that all of you rush to get your genetic testing done, because it is very important to be aware of the implications of the results of genetic testing. So what I would advise is for you to know a detailed family history. You need to know if there is any history of cancer or any other, inherited diseases, and if yes, how many members, at what age they've gotten it, etc. I think it is very important that for you to go and have a discussion with your breast cancer surgeon, your breast cancer specialist, your oncologist about the implications of this family history and the implications of a genetic testing. It is important for you all to undergo a genetic counseling, and the genetic counselor can then advise you to undergo a test because the implications are many. So I would not advise you to go run to your nearest lab and get your genetic test done. No, not at all. Yeah, not at all breastfeeding. Or some women have come and told me that, have they gotten breast cancer because they have breastfed a child? So let me just tell you, the concept about breastfeeding children being protective against breast cancer is because during that period of breastfeeding, their exposure to estrogen reduces because the female hormone prolactin is elevated. The hormone levels of prolactin is elevated at that time. So it decreases their exposure to estrogen. So breastfeeding is protective against breast cancer. But that does not mean that we have patients who've had 7 children, 10 children, and they still have gotten breast cancer. So that does not mean that women who have breastfed will definitely not get cancer, and also does not mean that women who have no children and have never breastfed will definitely get cancer. So these are myths that I would like to bust. And the second thing, which is very important, is the thing about soya. A lot of people come and ask me that I've been told not to eat a lot of soya, it causes breast cancer. So the thing is, soya as a food, it has something called phytoestrogens, right? So these are plant-based estrogens. They have actions similar to estrogen. But if you look at the literature, it's quite surprising. Asian women who have a higher intake of soy components in their diet, they actually have a lower incidence of breast cancer. And their incidence or their risk for breast cancer increases when they migrate out of Asia. They move to the Western countries. With the urbanization and with the move, their dietary habits change. It becomes more urbanized. They eat a lot more of processed food, and then automatically their risk for breast cancer increases. So, but we also do have some concerning evidence. Not very strong, but yes, there is some evidence in literature that points to the fact that certain patients with hormone receptor positive breast cancer, it is better if they do not consume a lot of soy. So the evidence, is not very confirmatory. So what I would like to say in this regard is eat healthy and eat balanced. Include a lot of fiber in your diet. Reduce your intake of saturated foods and a lot of processed food, foods with a lot of salt in them. Salted meats, processed meats, increase amounts of red meat. It's very important that you restrict your intake and consume everything in a moderate and very balanced manner. Reduce your intake of alcohol. I always advise against smoking. So stop smoking, reduce your intake of alcohol. And whatever you do, ensure that it is balanced. I don't endorse like a completely, no carb diet and, high fat diet and things like that. I believe in eat in moderation, eat in a balanced manner, balanced diet, take in a lot of fiber, and that will definitely protect you and reduce your chances to contract cancer. The way to sort of break this stigma, to get through all of this and just kind of pull the cobwebs away, is to talk. Just talk about it. Talk about it to those who listen, and it's so easy today. You have social media, you have a lot of brave women and survivors who are coming out in the open and talking about their struggles, putting it out there, be it on Facebook or Instagram, be it on their blogs. There are a lot of so I think that is one way to do that. It's very important for survivors and the relatives of survivors to come forward and spread the message and take it out there. So, they can have meetings and they can have an awareness group in their building, in their locality, in their companies. It's I think, you own a company as well. So I think it's very, very important to sort of dissipate this knowledge amongst the various levels, not just the literate, but also the others who probably can't read or write. And if we, take that one step at a time, and we're cognizant and we're mindful, I'm sure we can spread this knowledge and awareness over greater sections of our society. And of course, it would definitely help if we take this initiative, at a national level, have a campaign around it, spread the word, talk about the increasing incidence, but pay emphasis on how best to how best to be aware, lifestyle modifications, what are the causes. I always say knowledge is power. Education is the way to go to sort of bridge the gaps and bring all of us closer, and also to have a more sensible and protected society. Same thing, all the reasons that we've discussed, all the lifestyle changes that come with urbanization. Women must work. I, being a working woman myself, but then what happens is chasing career goals, getting into rat races. We tend to sort of push forward our life decisions like marriage and child rearing and bearing, and so women tend to get married after the age of 30 these days. They have children much later, and then the problems that come associated with late childbearing, difficult pregnancies and difficulty in breastfeeding, of course, some congenital abnormalities. So these are the things. Then of course things like diet, improper diet, increased intake of processed food, increased intake of alcohol and smoking. So I think if we're just a bit cognizant about this, I think it would serve us well. I recall a professor of mine, one of my mentors, when I told him that I wanted to take up surgery. This was just after my MBBS. So he was my mentor, and I told him that, sir, I want to take up surgery, but everyone's dissuading me from doing it, and they say that you're a woman and you should get married and have children, but I want to be a surgeon. So what he told me was, Manjula, do what you want, follow your heart's desire, but just ensure that if it's a family that you want, that you allow life to go hand in hand with your career. Don't put life on hold to, for your career to go ahead. Just ensure that everything happens at the right time, which I think is very, very good advice for all the women out there.
That is actually very important points you mentioned, ma'am. And talking about lifestyle, one should really do everything in a parallel way. As we come to the end of the session, I'd like to thank you, ma'am, for sharing such insightful and important points around breast cancer. And as you rightly mentioned that knowledge is power, I'm sure this session must have helped our audience, and now they are more aware to ask right question at right time to their respective topics. In next episode, we will talk much more in detail about how to choose the right inner garments in various phases of treatment and post-surgery. For any further queries, please contact on the details given here. And thank you very much.
Thank you so much, Sushmita. It's been a pleasure. I love doing this session with you. Thank you so much for having me.
Thank you very much.